My name's Hannah Mehta. I'm representing myself and my son Aiden, as well as approximately 1,800 Texas families with medically fragile children as the executive director of STAR Kids Advisory Cmte. I wanted to just take a brief moment and reflect back on the past year. So 1 year ago this week, we all sat in this room and listened to parent after parent and provider after provider express significant concerns, unresolved issues that had not been addressed with the STAR Kids rollout less than a month and a half away. Yet, during that time period, we were repeatedly assured by HHSC leadership that not only was the STAR Kids program fully ready to go live, but this product is different and has been customized for the needs of medically fragile children, and we were told repeatedly that it would not be the same as other managed care products. Time and again, we were told that parents' concerns around increased barriers to care, increased denials, reductions in nursing and therapy services, conflicts between primary commercial plans and MCO plans, and other difficulties historically experienced in other managed care programs were simply parents fear-mongering and ignorant parents who really didn't understand the program or what was trying to be done here. Yet here we sit 1 year later. Red tape, bureaucracy, barriers to accessing care have exponentially increased since November 1st, 2016. Broken families who are already overwhelmed and maxed out are stressed beyond belief attempting to meet basic daily needs for their fragile children that previously had not been a problem to access under traditional fee-for-service. Denials abound. One physician in Dallas who specializes in dealing with children discharged from the NICU recently told a family that they were unable to respond to a denial and provide them with a letter of medical necessity in a timely fashion because they have been completely overwhelmed with MCO denials and are swimming in them at a level that they have never seen before, to the point that they were going to have to hire a full-time nurse solely to deal with denials. On a daily basis, families with medically fragile children are experiencing PDN nursing hours being dramatically cut, from as much as 78 hours a week to 18 hours a week, or from 80 hours a week to nothing. Not just by 1 or 2 MCOs, but multiple MCOs across the board. Therapy denials are rampant across all MCOs, and families are essentially being intimidated in many so-called fair hearings, with as many as 10 or more representatives of the MCO defending a denial versus a parent and a therapist. One family was recently told in so many words by a medical director representing an MCO that their medically fragile child basically isn't worth the cost of therapy because of her diagnosis and associated long-term prognosis. The therapy rate cuts are being used as an excuse to increase denials and further cut services. Problems accessing prescription medications abound, and as recently as this month, it took one family nearly 3 weeks to obtain an urgent and critical medication for their medically fragile child in crisis, due to barriers set up by the MCO, to the point where the child's condition has now deteriorated and his physicians are talking about full TP and IV nutrition being the only viable option. Indeterminable conflicts between private commercial insurance plans and secondary Texas Medicaid managed care plans abound, to the point that we have actually seen some families drop their primary commercial insurance and others are seriously considering doing so. Medical necessity denials for MDCP have massively increased, far beyond historical denials, and it is clear from the data that there is a breakdown or problem with the new process and or the new tool, or all of the above. And yet, requests to address this issue in a way that holds families harmless has seemed to have fallen on deaf ears. While we very much appreciate the efforts of HHSC to perform internal desk reviews and other items, it still does not address the greater underlying problem. Hiring A&M to hold feedback sessions with families, providers, and MCOs to review the SKSAI and propose long-term changes more than a year or so down the road is great, but it is not an adequate or appropriate solution to the current urgent problem and underlying broader issue of a breakdown or multiple breakdowns in the assessment and approval process. Furthermore, it is an enormous conflict of interest. A&M were the ones who developed the current tool. Why are we hiring them to assess their own work and to review their own work? As I sat here listening to the discussion about the massive increase in denials, I also heard families blamed for this problem. Families are not reading their email or their mail, therefore they're not understanding what the process is. They're not understanding the letters. And I just have to take a minute and stop and think about that. Why aren't families being held harmless in this process? HHSC has changed this process, and the responsibility lies with HHSC to identify the breakdown in the process and correct the problem. Families should not be suffering the impact of HHSC's inability to admit and address mistakes and rectify the issue. What I also didn't hear was the June and July denial data that has been requested repeatedly for months on end, or the fair hearing data that has also been requested repeatedly for months on end. I didn't hear anyone talking about how we can drill down into the broader process and use that data to address and rectify the underlying problem and put a halt to the denials until we can identify and correct where those breakdowns are happening in this brand new system with multiple possible points of failure. That, to me, as both a parent and a representative of many families across the state and a business person, is unacceptable. Above and beyond that, formal complaints from families and requests for assistance with resolution to the Health Plan Management Unit, the Ombudsman's Office, and many others within HHSC who have been referenced as resources have not only produced very little in the way of results, but usually are not even properly documented. If we don't have good data, how can we make good decisions? So 1 year later, as we sit and look back on all the promises that were made when we all sat in this room last September and before that, are we really where we want to be? Has this program improved families' lives and their ability to care for their medically fragile children? As a representative of families and as a family member myself, I would have to say my answer is no. And that is not acceptable. Thank you for your time.
Hannah, if you have your remarks written down, would you provide us with a copy, please?
I don't have a hard copy with me, but I can certainly send it to you.
Thank you.
Thank you, Hannah.
Hannah brought up a good point. If we are seeing a big increase in these MTCP denials, why can't we just pause them until we have a chance to look at the numbers?
And I think a number of us have asked that.
Who
We can
can
make a recommendation from this committee that
I think we should.
I
think one of the things that Hannah, when she was speaking, and I don't think I articulated this because, again, I'm 5 years down the road, is it really is severely impacting families, and we need to make sure that we have, I don't know what it is, an escalation process, whatever it is, for these individual families who are not being able to get medication, not being able to have surgeries, whatever it is, because they're in this denial process. And I think we need to set a deadline for HHSC on, can we pause denials for, 90 days until we have numbers and evaluate.
And I think that we could do that. The Policy Council on Children and Families voted that and pushed that forward and sent a letter to HHSC asking that. I don't know that we've gotten our answer back on that, or it was a no. I think that we can do it again as this body.
I think we should.
I'm very worried about the fact that, like I said, 12%, and that was for May. And that was an increase from the previous 2 years. I think 1 year was 2 point something, and the other was, or 1 year was 3 point something, and the other year was 2 point something. That's a historical kind of basis.
Because I think there are things you get if you're in a denial process, you still can keep your medical, but then other things like respite.
No, you can keep it.
It's all
keep all
okay.
of that, but that's not the point. I think the point is that there is definitely something that has happened. When you look at the rate of denials now compared to what they were a year ago, what they were 2 years ago, what they were 3 years ago, what they were 4 years ago. I think you all went back to 2013. So that was 4 years of historical kind of data. And the fact that we're so delayed on getting the data because the data is complicated and it's messy and there's duplication and all of that, while we're waiting on that, people are getting kicked off the program. Some may be appealing, some may not be appealing, and I know that HHSC is calling people, but the reality is people are being denied.
So how do we draft that letter?
I think that we can just, I guess we send a letter from this group like we did the last letter, asking for it to continue, asking for a pause on and I guess that we say that we use their old last year's eligibility, and that they, for another, until HHSC can get to the bottom of it. That when Policy Council on Children and Families did it in July, we were hoping we did, I think, a 90-day or 60-day, but now that's come and gone 60 days.
Can we go back to when we had the last set of numbers?
June, July, August, September. There are already people who have been denied for June, July,
Right.
August.
So can we go back to and just all of the people that have been denied,
That pause the denials.
pause those denials? Can we request that?
I think we can make whatever recommendation we want. What?
Operationally, it sounds really confusing for those that have gone through their state fair hearings and I mean, have finished the process.
But if they finish the process and they've gone through the fair hearings and the fair hearing, so you're thinking of those who went through the fair hearing and got denied?
Whichever. I mean, some people, you can't, it just seems very legally difficult to go back 5 months and wash it away.
But that's on page 8.
Yeah, so can I just kind of say, yes, as the committee, you can recommend whatever you want, and I'm not going to get into how you should do that. I just do want to say that we have heard you. We got the Children's Policy Council letter, which we are very close to finalizing, and in response to these concerns are all the things Jamie has laid out. You know, we have been doing desk reviews. We have A&M doing this additional work. We have PSU calling families, and so it's not that we are not doing anything about it. I think she laid out those steps that we're doing, you know, to look at these issues. So I think I just want to say, you know, you guys can recommend whatever you want. We'll just have to take it back and discuss how to respond.
And I do think that clearly, I mean, the A&M thing, I really do feel like that's a separate thing. I don't think that's really in response to this. I think it's something entirely different, and I think that it's a good thing, but it's something entirely different. And I think the PSU calling families and making sure that they know that they have the ability to appeal is great. It doesn't solve the fact that, and I think the desk reviews are good, but the desk reviews are just desk reviews in a vacuum, and you don't have the clinical data. You don't have a lot of things you need. So it just seems like there's got to be that piece that protects families. And I you know, to say that a fair hearing process is the protection for families, I think is not necessarily totally accurate, because it throws families into a panic that is indescribable, and creates a whole flurry of activity that some families are going to be able to manage, and other families are going to throw up their hands and say, I can't do this. So I mean, it feels like, I mean, one of the things that I had thought was a recommendation could be go back to the old way of doing this, the MNLOC, that seemed to have the 3%, the 2%, you know, which may have made 2 or 3%, may have made sense, you know, if that number of kids, maybe their condition changed, but the 12% out of the blue is outrageous. So if there was a way, I mean, I don't know that it would be that hard to go back to the old MNLOC for the MDCP part of it.
Yeah, I don't think that's administratively feasible.
But it's not. We've got to get to something, because at this point in time, we are. I mean, that was just something I threw out there because we hadn't gotten a response to stop the assessments and clone all of them until this can be figured out.
Well, I also do want to add, and you guys know this, but you know, we have an obligation to our federal partner CMS to determine people's eligibility for services on a yearly basis.
With a reliable, reliably assess and determine their eligibility for service. And I think CMS, I think CMS would be concerned if they saw that all of a sudden, with a new tool, that we have quadrupled our denial rate or tripled our denial rate.
Well, I think that, I mean, again, I just want to say we're responding to this by looking at all the things we can and have not found egregious problems. I mean, and I think you know that if we had looked at all these different things and found, oh my gosh, this is wrong, we definitely would,
But Emily, I
act right then.
But I disagree there. I know that you all are working, but Dr. Glenn said it. There's only so much that they can do with UR given the fact that what they've got and their staffing abilities. So while they are looking at this tool compared to the previous tools, they're not calling and getting that information from the family. They're not calling and getting the clinical information from the physicians. I mean, you're just looking at one tool compared to another tool, but you don't have the full picture. I mean, I think that everybody would agree that's a huge jump. I mean, I don't know. There's got to be some protection for besides fair hearing. We've got to, while this process is new, we clearly now know that there's something wrong. I don't know what it is, but something is wrong. And it could be a bunch of things all combined into one, but I don't know. We've got to do something for families.
Sorry, I just wanted to add two things to my comments, and that is, Emily, we appreciate...
Hannah, please state your name.
Certainly. Hannah Mehta on behalf of Protect Texas Fragile Kids. Emily, we appreciate the efforts of HHSC, and Gary and Jamie and I have had multiple discussions about this. As you know, we approached Gary and Jamie about this issue back in April when we first started seeing a massive increase in denials, and asked at that time that a review be done in depth to look at where the breakdown in the process was. So this is not something new. This is not something that has just come up in the last month. This is something that has been requested repeatedly. And while we appreciate these administrative efforts, it's too little too late. It doesn't address the underlying problem. And it doesn't hold families harmless. In fact, it squarely puts the onus directly on the families, which is unacceptable and unreasonable. And so something more needs to be done to say, whatever this breakdown is, we need to start from square one and identify where it is happening and what the problem is. And doing a desk review is great, but that doesn't start from square one and give you the full picture, and it's not comparing apples to apples. So that would be my response to that, because we've had this conversation repeatedly and it's not the first time. And then the second thing that I would just add to my comments is, where's the data? What is being done to track these families that are being denied and identify what is happening? Are we seeing an increase in hospital admissions? Are we seeing them admitted to institutions? What is the trajectory of the long-term results of denial?
And not seeing a huge increase in the number of children moving into nursing facilities right this second. But then again, this is all pretty new, and so people might be in the appeals process. I don't know about other institutions, but I'm just speaking from that.
Right. Thank you.